Welcome everyone, good morning, good afternoon or good evening, depending on where you are, and welcome to this virtual track event of the World Health Summit, which is focusing on investing in women and resilient health systems, and as a subtitle, investing in midwives. Sexual, reproductive, maternal, newborn and adolescent health, or SRMNAH, is an essential component of the Sustainable Development Goals. And improving SRMNAH requires increased commitment to and investment in the health workforce. The body of evidence demonstrating the return on investments in midwives has really grown over the last few years. It indicates that investing in midwives facilitates a positive birth experience, improves health outcomes, expands access to safe and effective comprehensive abortion services, augments labor supply, favors inclusive and equitable growth, and facilitates economic stabilization. And this can also have a positive macroeconomic impact. The COVID-19 pandemic has shown a light on the importance of investing in primary healthcare for meeting population health needs. And midwives are an essential provider of primary healthcare and can play a major role in this area, as well as in other levels of the health system. Speakers will review the latest evidence on midwifery and the investment and policies needed for a strong midwifery workforce to achieve UHC, or universal health coverage, and for the global health security. So we're going to look at three issues during this session. So we're going to look at what is the impact of COVID-19 on SRMNAH services and the workforce. Secondly, what investments and policies are needed for midwives to deliver services? And thirdly, how can strengthening midwifery contribute to the realization of universal health coverage? So allow me to introduce the speakers. We will have the Right Honorable Helen Clark, who is the chair of the board of the Partnership for Maternal Newborn Child Health Services, or Health, sorry, which is PMNCH. And she was also the former, or she is the former, Prime Minister of New Zealand. We will have Maria Flachsbart, who is the Parliamentary State Secretary for the Federal Ministry of Economic Cooperation and Development, or BMZ in Germany. We have Annika Klutzen, who is the Chief Sexual and Reproductive Health, the Chief for Sexual and Reproductive Health at the United Nations Population Fund, or UNFPA. We will have Dr. Sally Perrman, who is the CEO for the International Confederation of Midwives, or ICM. And we have Her Excellency, the Minister of Health, Peggy Fidot, from the Seychelles. So with these opening remarks, I would like to allow for the panel speakers to make a few short opening remarks. And I hope that Helen Clark has joined us. And so Helen Clark, over to you. No, I think Helen has not yet been able to join us. So in that case, we will move to the second speaker, and that will be Your Excellency Peggy Fidot, the Minister of Health from the Seychelles, to give your opening remarks looking at investment in midwifery education and training, midwife-led service delivery and leadership. Over to you.
Good afternoon, and thank you for inviting me to be on the panel. I'm delighted that as a midwife, I can join the rest of you to participate in this important discussion on investing in midwives. In spite of the fact that there has been lots said about the contribution of midwives in advancing and making advancement towards the Sustainable Development Goals, yet it is obvious with the information we have, especially in the latest State of Midwifery 2021, that we haven't done sufficiently, we haven't invested sufficiently in the education and training of midwives, and that's globally. And that's due to a number of factors, but they are not things that are unsurmountable. Investing in midwifery education and training will not only address the global shortage of midwives, but will greatly improve the quality of care in sexual, reproductive, maternal, newborn, and adolescent health. And it will contribute, we know, to a number of lives to be saved, especially lives of women and children. We know that it will empower girls and women to take charge of their fertility and permit them to be more economically active. And this will certainly have a positive impact on the labor supply and economic activity of any country. And no doubt, it will be a major contribution to the attainment of universal health coverage. We also know that apart from deaths, which are averted by the investment in midwives, there will be less complications and much fewer interventions. And this in itself will bring about a whole lot of savings for many health systems, because we know that attention and reacting and working on complications is nearly always costly, not only in terms of suffering, but also in dollar sign. Investing in education and training of midwives will also address the global shortage of midwives world over. And for this, as we look at evidence, it is obvious that we need, apart from more training programs, but that we really need to be investing in more programs for educators in midwifery, because without adequately prepared educators, the level of professional midwives that will be produced will not be of the sufficiently high quality to deliver the services that the world needs. We realize that midwives, always give good outcomes. And if we allow midwives to function at their full, within their full scope as indicated by their regulatory body, we know that a lot more can be achieved within primary health care. And for this reason alone, we need to really push for more investment, because the impact will favorably will be favorable for broader health goals. However, to make all this happen, there needs to be a lot of effort countrywide and nationwide. But one thing that will really contribute to that is really having midwives in policy-making decision positions, because we need midwives to be contributing to policies that affect their profession, that affect midwifery. But more importantly, midwifery needs to be seen as part of an integrated service, and therefore midwives should also be contributing to policies, to health policies, and even to policies in the social sector. So my belief is that this panel this afternoon will be contributing greatly to the investment of midwife and to better health outcomes. Thank you.
Thank you very much, Minister of Health. And I would now like to move to Helen Clark, as I mentioned earlier, the former Prime Minister of New Zealand and the chair of the PMNCH board, to give opening remarks on strengthening midwifery workforce to advance universal health coverage and global health security. Helen, over to you.
Thanks, Anshu. Greetings, everyone, and sorry for the slight technical hitch which delayed me. Well, clearly, a strong midwifery workforce is absolutely essential for achieving universal health coverage. For women, the support of a midwife during pregnancy, labour and childbirth is an indispensable service. And midwives are also so critical for ensuring that sexual and reproductive health and rights are fully integrated into universal health coverage. According to the most recent State of the World's Midwifery report, well-trained midwives could help avert roughly 2/3 of all maternal and newborn deaths, and could also deliver 87% of all essential sexual, reproductive, maternal and newborn health services. Well, a profession as important as that absolutely has to be supported, has to be strengthened, including by investing in education and ongoing professional development, and ensuring that our midwives are properly remunerated. In response to the impact of the pandemic on the rights and health of women, children and adolescents, the Partnership for Maternal, Newborn and Child Health, which I'm privileged to chair, issued a call to action on combating the devastating direct and indirect effects of the pandemic. And part of that call is advocacy for strengthening the recruitment, training, pay and safe working conditions for frontline health workers, and those most obviously include our midwives. I would hope that countries will conduct their own in-depth reviews of what worked and what didn't in their health services during the pandemic. I co-chaired the independent panel for pandemic preparedness and response, commissioned by the World Health Assembly and requested by Dr. Tedros. And I have a very clear recollection of the messages we received from midwives in the consultation we undertook with them, where they talked about the difficulties they faced in getting just adequate personal protective equipment and being able to provide the quality of services they wanted to provide to women. So in building back better and more resilient health systems, as we recover from the pandemic, when we get to recover from it, it is really important that midwives are fully engaged in the design of that, and that midwives' views on what makes for quality and resilient midwifery services are fully incorporated going forward. I can't underline that too strongly. The midwives' voice must be heard and their input must be facilitated. Thanks.
Thank you very much, Helen, for those opening remarks. I will now move to the next speaker, and that is Sally Perrman. And Sally, you will give some reflections on investment and policies and the role of midwifery associations and civil society, as you are representing ICM here. Sally, over to you.
Thank you, Anshu, and it's a pleasure to be here. I think I can follow on quite nicely from what Helen said, actually. Because we've got all of the evidence. We have so much evidence about why it's important to invest in midwives, and if we did, what a difference that would make to the health outcomes and the quality of services that women experience across their sexual reproductive lifespan. But despite all of this evidence and the many, many reports, including the State of the World's Midwifery 2021, that show all of the reasons to invest in midwives, we are not seeing that investment. And really there's a sense that there's a continual, the governments continually ignore this largely female workforce and the women that they care for. So why is that? Why do we have the evidence and yet we are not acting? And it has to come back to the sort of gendered nature of midwives' work. You know, we're essentially a women's workforce caring for women. And there's no denying that underlying poor maternal and newborn outcomes, as well as low status and pay for midwives, are evidence of the harmful gender stereotypes and norms that limit funding for midwifery. But as Helen said, midwives are actually a voice to be listened to. And it's important that we support, and this is the work of ICM, to support our member associations, midwives associations in every country of the world who are speaking up for the care that they provide They are the technical experts on midwifery and sexual reproductive health and rights. They have important perspectives. And as Her Excellency Peggy Vito said, they need to be at the table where decisions are made regarding sexual reproductive health. They bring a unique perspective, and not just because they are midwives, but because they are working so closely with women and they understand many of the issues that women are facing. So we're encouraging our midwives associations to work closely with civil society to bring those two voices together. And one successful campaign that I'm sure people have heard of is with our campaign with White Ribbon Alliance, where a couple of years ago we looked at what do women want. White Ribbon Alliance led this campaign, and we saw that over 1 million women in the world said they wanted respectful care, and fourth on their list were midwives. And now we're doing a campaign about what midwives want and identifying the same sorts of things. What is it that midwives say need to happen to actually make the changes that will bring investment in their important work? So I encourage everybody on this call and listening to this call to support midwives associations, to support midwives, to hear what they have to say and to take their perspectives into account as we look at important issues of investment. Thank you.
Thank you very much, Sally, for those remarks. I would now like to move on to Maria Flaxbart to talk about a donor perspective, because she's representing the government of Germany here, to talk about a donor's perspective on RMNCH and investment in midwifery. Maria, over to you.
Thank you very much, Anshu. Distinguished co-panelists, midwives and other health workers are on the front line fighting a pandemic and other critical circumstances. They play a critical role in delivering primary health care. So they provide vital services for women, for newborns, for children, not least during the COVID pandemic in the moment. And the international community needs to work together to close the existing gaps as regards access to essential health services in low-income countries. So we need to ensure that healthcare professionals are given high-quality training, a decent working environment, and adequate wages. Health workers provide essential services, and this is why they need special protection in times of crisis, such as war, of humanitarian disasters, or of pandemics. And this begins with a special protection material, such as gowns, gloves, masks, and these things. And that is why Germany will continue to support efforts to strengthen health systems and train experts to build capacities in health care, as it has done for so many years. I would like to give you some examples of our support, especially in these times of the COVID pandemic. We made a bigger core contribution, for example, to UNFPA than usual in 2020, 70 million euros. And we increased our funding to IPPF to 15 million euros. In 2021, we provided 40 million euros to UNFPA, and over that of 700,000 euros for UNFPA supplies. The Maternal and Newborn Health Thematic Fund received 2 million euros in 2020 and 2.5 million euros in 2021. And overall, our contribution to the global financing facility in 2020 and 2021 have a total of 50 million euros. These are only some examples that we just don't give good advice, but we try to help and to support so much as we can to give a strength to this very, very important work. Thank you.
Thank you, Maria. And the final opening remark will be from Annika Klutzen, the Chief for Sexual Reproductive Health at UNFPA, and really to highlight what came out of the State of the World's Midwifery Report for 2021 and the impact of COVID-19. Annika, over to you.
Thank you. And let me first start with really thanking Dr. Flashbach and Germany for all the support that you have provided for UNFPA on our mission to really make sure that SRHR remains essential services during the pandemic. And it has never been more important than now. And let me just say briefly how we see the connection with the State of the World's Midwifery Report that came earlier this year and how that relates to COVID. What the report showed, and also I should say a paper that was delivered or published before the actual report, was of course that the impact of midwife-led interventions on maternal mortality even before the pandemic started, the levels of maternal mortality and maternal ill health is tremendous. If we have a universal access to midwives, we can save 4.3 million lives every year until 2035. But even with a 10% increase, that would, give us a yearly annual life saved amount of 1.2 million lives. So, and the impact is, of course, on the broader SRHR, not just on maternal or direct maternity care. Now, we know from the report that we still miss 900,000 midwives to make this come true. And if we go in the current pace, as we have now, we know that by 2030 or 2035, we will have a gap that has closed a bit. But we will still lack 750,000 midwives. And in Africa, that gap has not closed at all. The 500,000 that are missing today will be missing tomorrow. And what we see then with COVID, and I know that many here have spoken about that, is that midwives were, how can I say, in a biased way, affected also by the COVID in terms of their work environment. So unless we make sure that the health systems really build resilience around the health workforce and midwives in particular, we will not be able to create that resilience around sexual and reproductive health. So what the State of the World Midwifery really have brought is a tool for governments to understand how a resilient health system, it's not the only thing, but it's a very big pillar of how you build back from COVID. So I think I'll end there and come back to some other remarks later. Thank you.
Thank you very much, Annika. And this session is co-hosted by PMNCH, UNFPA, and the BMZ, or the Federal Ministry of Economic Cooperation and Development from Germany. And it's nice to have heard from Helen Clark as the chair of the PMNCH board, from Annika Klutzen representing UNFPA, and from Maria Flachsbart representing the ministry. So we'll now go into the panel discussion. And the first question that we would like to address, and Annika, I think you are going to be the first speaker to talk about this, is what is the impact of COVID-19 on sexual, reproductive, maternal, newborn, and adolescent health service delivery? How can the impact of COVID-19 and its broader social and economic consequences be observed on maternal health and other reproductive health outcomes? How do midwives impact on a wide range of clinical interventions and contribute to the broader health goals, such as addressing sexual and reproductive health rights? Annika, over to you, and then after you we'll have Sally, who will provide some additional comments on this issue.
So yes, checking, I'm sure I have approximately 4 minutes right now. Thank you. And thank you for this opportunity to speak about such an important topic, because the impact of COVID has both direct impact on the SRHR health and well-being of women and adolescents, but so many more and such much bigger effect on the more indirect effects from COVID. We know that the lockdowns and the situation for women has, of course, impacted also what was already there and exacerbated the vulnerability of many towards gender-based violence. And then on top of that, not being able to have the services that they really need to access. I think that the virus pandemic, the corona pandemic, has really revealed and highlighted the deep fragmentations, the inequalities and the dysfunctions within maternity care. Of course, that, as I said before, existed before the pandemic began. And I think this pandemic offers both a disruptive moment, but also a long overdue opportunity to fix systemic problems within maternity care, but also in the broader SRHR, because we cannot just focus on one part, even if that's the most urgent, and maybe the maternity and perinatal care is where you see that lives are in jeopardy and lives can be saved. But there are so many other areas where young girls and teenagers do not have access to contraceptives. We know that the unintended pregnancies will rise. And I avoid a little bit to put figures in here in what I say, because all the figures that have been put out there are, of course, modeled figures. But we know that unintended pregnancies have risen. And we know that unsafe abortion as a result of that also has risen. We had reports in UNFPA around countries in Latin America where we see that in Honduras, the maternal mortality has risen by 72%, starting at what we call a low number, but still we have other countries in Latin America where we see similar increases of maternal mortality, which is of course extremely worrisome. And it has to do, of course, with the disruption of services and the not understanding that midwifery is actually a distinct profession. And so midwives have been moved from what is their essential role to other types of care. So what we know about how and why women seek care from the health system is that we know that a rumor of lack of care or poor quality of care that travels really fast in the networks of women. And so that is something that has also exacerbated the willingness or the opportunity to really take themselves to care. We see that in Puerto Rico and Mexico, community-based midwives were held under suspicion of spreading contagion and denied the ability to accompany their transferred clients in hospitals. Another way how the pandemic has really exacerbated and really made it more difficult for women to access care. I think, Anshu, you will have to give me a half a minute warning because I get carried away.
Yes, well, you have spoken already for 6 minutes, actually. So
I'm so sorry. So let's stop there. But I really want to say this is really essential services in a pandemic. Thank you.
Thank you, Annika. And so, Sally, maybe for some additional reflections from you, short ones.
Okay, thanks, Anshu. I mean, I think, everything that Annika said, I totally support. And I come back to what I said before about this is women and a women's workforce caring for women and being invisible actually during COVID. So we know that women were extremely frightened to go to hospitals to give birth. They were scared that they would catch COVID. We know that many of the maternity services were closed down and turned into COVID hospitals for the general population. And we know that women, many of their rights were not upheld, have not been upheld. So partners not able to be present at birth, women having to give birth on their own without family support. We've seen an increase in medicalisation, unnecessary medicalisation. We've seen, as Annika said, an increase in gender-based violence. We're sure that there's an increase in mortality and morbidity. And this is going to have a psychological, long-term psychological also impact on the women. And for midwives themselves, you know, they also were frightened. They feared for themselves. They feared that they would take COVID home to their families, especially because they really struggled to get PPE in many, many countries. And they have been trying to provide services for women themselves, and often in situations where they have not been supported because community-based midwifery services haven't been part of the normal health system. And yet we know that many midwives used innovations like doing phone calls or video calls, or trying to provide care, or coming to the window to do an assessment of a baby outside a house, to try to provide care to women while at the same time keeping them safe and themselves safe. And these issues, despite now, what are we, nearly 2 years in, these issues are still there. So there's much still to learn about how to actually manage COVID and continue to provide a maternity service and to support the midwives who do that.
Thank you, Sally. We'll move to the second question for the panel. How do investments in midwives impact on positive birth experiences? What are the key actions that policymakers can take to strengthen the midwifery workforce in their countries? And this is really about leadership. And I think the minister earlier also spoke about leadership for midwives. So Sally, you will be kicking off here, and you'll be followed by the Minister of Health from the Seychelles, Peggy Vidot. Over to you.
Thank you. Well, as we well know from the State of the World's Midwifery Report what we need to do. We know that we need to invest in more midwives. Annika's spoken of the shortage already. So we need to educate many, many more midwives, and then we need to deploy them into the workforce so that they actually can provide the care that women need. So we need more educators. We have a huge shortage of midwife educators to teach these new midwives. And we need deployment, education, working with the health system to get the midwives out there. We also know that midwife-led models of care, especially continuity of care, provide the best outcomes for women and their babies. And in order for midwives to be able to provide that kind of care, they need to be working in an environment that supports them, that gives them the resources, the respect, the systems to actually enable them to do their job effectively, to be an integrated part of the health system and a central part of the maternity system. They need regulation that upholds their autonomy and helps them to do their work across their scope of practice, and they need leadership and governance. So we need to invest in all areas: more midwives, improved education and training, midwife-led models of care, and midwifery leadership and governance to make sure that women's needs are on the agenda, and that we are doing everything we can to support the midwives to provide their very, very important care. I'll stop there, Andrew.
Thank you, Sally. And I'd like to call upon the Minister of Health, Peggy Vidot, to make some additional comments on this particular issue.
Thank you. I think the investment case for the midwives is clear. Better trained midwives and increase the number of midwives will certainly improve quality care. The State of the World's midwifery has really outlined a tremendous impact of midwives' contribution to healthcare. And, as I say, the case is clear. I think we all know that midwives provide care even before conception, and this ensures that women get into labor, that continuum of care which continues throughout the antenatal period, really make sure the women get into to labor in the best possible health that she can have. And this in itself help to provide that good, positive experience of birth. Midwives prepare women for labor. And I think this helps the women to really gain confidence and to be more cooperative. And obviously this helps to the experience that women go through. Better trained midwives always help to come in with a diagnosis of any deviations from normal, and therefore assist in bringing on or advocating for early intervention so as to make, again, contribute to the birth experience in a positive manner. All of this really helps as midwives practice in these different settings. In terms of policy makers, what action should be taken, I think policymakers need to ensure that gender-based policies in education, not only in education of midwives or midwives educators, but right back to education, general education. We need to educate especially girls, because it is more, midwifery is more sort of a women's based occupation, but bring girls to the level, academic level, that they can then follow, they can then enter into a midwifery program at the level that the midwifery program is set. And this will improve the quality of care, midwifery care that can be given. So this is one area where policymakers can really make a difference, as well as in funding of education programs for midwives educators, and as well as infrastructures where midwives often are taken for their clinical placements, and to ensure that the competence is right across the board. The need for sufficient funding to absorb midwives as they are deployed to the different settings where they will practice, and as well as ensuring that the funding actually address the remuneration packages which they need to have. And above all, ensure that the midwifery practice, the midwifery profession is well regulated to ensure quality of care. And last but not least, policymakers need to listen to the voice of midwives. And it's only through that, learning what their needs are, that we can then improve the situation of midwifery. Thank you.
Thank you, and thank you again for highlighting that leadership element. We'll go to the following question. What investments from the global community are needed to strengthen the midwifery profession and the delivery of midwifery services? And as this is a question for the global community, first we'll ask Maria Flaxbart to respond to that, to be followed by Annika. Maria, over to you.
Thank you very much for this question. As all of us know, in the last few decades, we have fortunately made huge progress, both with regard to maternal and to child health. But a great deal remains to be done. Even now, every 2 minutes, a woman dies from pregnancy or birth-related complications in developing countries. We need to make a strategic, a long-term investment to protect the health of mothers and newborns. And we need to continue to strengthen health professionals, including midwives, in particular in low-income countries. So analyses and studies carried out by UNFPA and by other partners tell us that a close network of midwives in our partner countries would have the potential to prevent more than 2/3, 65%, of all maternal and newborn death and stillbirths. I think it has been mentioned before. So well-trained and properly equipped and well-organized midwives, they can offer more than just services during pregnancy, birth and postnatal care. They can also, and hopefully UNFPA will agree, they can offer most of the services relating to sexual and reproductive health. And so, however, midwives account for only a small share of the health professionals, less than 10%. There is a global lack of 1.1 million committed professionals delivering maternal and child health services and services related to sexual and reproductive health. The biggest shortage is among midwives. There was a lack of almost 1 million in 2021. So we need to work together to close this gap. We need to ensure that women have access to life-saving health care during pregnancy and childbirth, regardless of who they are or where they are living. So Germany has provided bilateral support and been a development partner for many years in the area of global health. And we attach great importance to efforts to strengthen health systems in low and middle income countries. We are doing this through bilateral programs and through our engagement in multilateral organizations and global health initiatives. Via our BMZ initiative on rights-based family planning and maternal health, we are making up to 100 million euros available each year to strengthen health systems, expand access to modern methods of family planning, and sexual education and professional support during childbirth. The majority of the health professionals worldwide are women. And that is why gender responsive and transformative measures in our programs are so important. The aim is to achieve gender equality and better opportunities for women, access to quality training, fair wages, and adequate working hours are to empower women working in the health sector. And because it is only if women and girls can flourish that society will flourish too. So access to essential life-saving health services will continue to be a top priority for Germany in the area of global health, also for the next government. I'm quite sure that will be so. So we are supporting such efforts through our bilateral programs in partner countries and through much valued partnerships with multilateral organizations. I have mentioned some before. And so I'm happy to repeat that we will provide support amounting 700 euros to UNFPA supplies and 2.5 million euros to UNFPA's Maternal and Newborn Health Thematic Fund. I think this is really, really important. And you're doing a marvelous work, a marvelous job. Thank you so much for that. Thank you.
Thank you very much, Maria. And Annika, would you like to make some additional comments?
What can I say? This is really such welcome news. You know, that there are so many more midwives that will be trained from this. But if I want, and I think Dr. Flachbach really made a very comprehensive outline of what the investments, where the investments are needed. But maybe if I just say education, we've spoken about that. What we haven't spoken so much about, the investment in professional collaboration is really key, and in leadership. We need midwives at the table, and really not just at the table, but in decision-making positions. So when countries like Germany show the leadership on investing in the programs for midwifery, I think I would encourage countries around the world to make the investments in also putting a chief midwife officer in their government or in their administration, because that will ensure that the care, but also the enabling environment for midwives will have a much better opportunity. So, for that.
Thank you, Annika. And we'll go to the next question. The midwifery workforce is overwhelmingly female, And the disparities are also impacting the status, the pay rates, and opportunities for midwives. In fact, Maria just highlighted these things as well earlier in her intervention. How can health systems support midwives and enable them to deliver quality services that reach those most in need? How do we build back better? So this is a question that first the Minister of Health, Peggy Vidot, will be responding to, and then she will be followed by Helen Clark. Peggy, over to you.
Thank you. I think in answering this question, the main thing that we need to be looking at is really the gender disparities, and that's sort of at national level, ensuring that we have more gender-based policies in education as well as in health, and policies which will help improve the status of women and thereby improve the status of midwives, because as a profession, it is seen mainly as a low status profession. We need to have the health system that ensure that health workforce provides the right number of midwives required to meet the needs of society. And then this should extend, because in many instances, the number of midwives is seen as only those providing care around pregnancy and after pregnancy, as opposed to more of the sexual and reproductive care that's required. And I know that many countries are still battling with their health workforce assessment, and therefore knowing the number that's required is not always evident. Health systems need to ensure that midwives are adequately prepared to take on the functions for which they have the competence, and for which their scope of practice permit them and give them the mandate to deliver on. And they need the service, the health system should permit them to use their skills to the maximum. And midwives' practice needs to be well regulated. We know that even from the state of the world's midwife, the number of people, the number of workers who call themselves midwife, the disparity between the different level of skills of midwives, across the globe, is probably, concerning. And we need to ensure that professional midwives are well regulated so that they can provide the quality of care, because we know unregulated midwifery gives rise to poor quality. And this in itself adds to the issue of gender, because they are often disrespected because of the poor health outcomes, which result in poor service. And this gives rise to a lack of confidence, and therefore affect the health-seeking behavior of people within any community. We need to allow them to practice in an integrated team, because their skills can extend to sexual reproductive health, to vaccination, to child adolescent health program, school health program. So midwives need to be given the necessary support wherever they are working, be it especially in rural areas, where they need to be given the required supervision, they need to be given the required resources so that they can practice safely, as well as provide them sufficient resources for their own protection, especially we heard of during the COVID time where the PPEs were not available. And I think this needs to be rectified. We need to have more equitable distribution within any country of where midwives are, so that they can better use their skills. And better remuneration packages. This is what is often has negative impact on who are the people who are attracted to midwifery profession. So we really need to address this. We need to have gender disparity in packages that suffered, more opportunities for advancement, more opportunities for higher education. And we need to have and encourage midwives-led services, because this provides, we know from all evidence that midwives provide, good quality care and often at a much lower cost than when we have other health professionals providing these services. So we should permit them to function to their full scope. And midwives' leadership position, I keep coming back to that, at national level, key to influencing policies, especially the gender disparity in terms of pay. How do we build that? We need to have stronger health systems that's resilient to all sorts of shocks, that address issues of health workforce planning, that investing in education of midwives, and that we need to build on lessons learned. Especially, we've seen a lot of innovation during the COVID pandemic. Let's use this to make our systems more resilient, to permit midwives to function to their fullest. Thank you.
Thank you, Minister. And I just wanted to highlight that as part of the State of the Midwifery report, not only did we look at a global modeling, and that showed that we have 900,000 midwives, or that we are short of 900,000 midwives, but I think we also did a modeling for each country so that you know for each country how many midwives are actually missing. And so if you have the data of how many midwives you have, you can also see what the gap is. Helen, coming to you, would you like to make any additional comments on this important issue about raising the leadership, equitable pay, recognition for the profession? Over to you.
Well, thank you, Anshu. I think that there's a whole lot of structural gender inequality issues involved here, with midwifery being a women's profession, serving women in health systems which really traditionally have been run by men, and midwifery has suffered because of these things. Now, for my money, I think it's very important that midwifery is recognised as a fully autonomous profession. Midwifery is a vocation, and it is a profession, and it requires a high level of skill. I have some personal experience of this as the Minister of Health in New Zealand, who empowered the midwives with professional autonomy to practice to their full professional competence, and that included prescribing. They weren't, quote, supervised, they were professionals. And the professionalism also gave the capacity to recognise when something moved beyond the level of skills that they had. But for most women, the skilled, trained, highly professional, autonomous midwife can do the job required. So it's a question of raising status, which may require legal changes, and also a question of addressing pay. Midwives are among the health profession's lowest paid workers, which is disgraceful when you consider the level of skill required. So again, there will be various mechanisms in different countries for dealing with historic pay inequity issues. There may be possibilities for comparisons, claims that can be taken under Equal Pay Act, whatever. But the pay issues have to be addressed, because if you continue to underpay year on year, decade on decade, it does get harder to recruit and retain in a profession, as people see other opportunities which may remunerate them better. So I would address the issues of professional autonomy and status and the issues of historic pay inequity. And I think that will be part of beginning to address the workforce shortages that we're forecasting at the moment.
Thank you, Helen. Before I go to the last question, I would just like to alert our audience that you can put questions in the Q&A. After the following questions, we would like to open up for question and answer. And so let me come to the next question then. And Helen, we will start with you. How has the pandemic impacted the sexual, reproductive, maternal, newborn, and adolescent health workforce, including midwives and nurses? How does strengthening the health workforce contribute to the realization of universal health coverage? So we'll start with you, Helen, and after that we'll have additional comments from Maria. Over to you.
Well, I think my observation, based on the information provided through Partnership for Maternal, Newborn, Child Health, what we've been hearing from the International Confederation of Midwives and others, is that it's almost extraordinary that midwifery as a profession and a service somehow didn't seem to get the protection that an essential health service should have in an adverse event. And I think in building back better, it has to be front and center that midwifery services must be supported to be resilient. It's like the old saying, the post must get through. The post will always get through. The midwife has to get through. Women will continue to become pregnant and have babies, pandemic, no pandemic, whatever. So there has to be resilience in the service. And it's heartbreaking, really, to listen to the stories of midwives and how they felt, kind of almost abandoned. Salaries not coming through, equipment not coming through, not being able to do the job. And I think Sally used the term, midwives really being quite frightened themselves because of what they were confronting. In my own country at the moment, we're trying to move to a very high level of vaccination and a level of public health measures to, quote, manage around COVID as an endemic disease. And my thoughts go immediately to the midwives. We've been protected here for the most part of the pandemic without much community transmission. But as we begin to, quote, live more with this endemic disease, the midwives are going to be going into homes and into health services where they're not entirely certain what they'll be striking. So we really have to support this profession to be as resilient and protected as it can be, as it offers these vital services. I think that's what I'd most want to underline here.
Thank you, Helen. And Maria, would you like to come in and make some additional reflections on this issue?
Thank you very much. Perhaps some short additional thoughts. So it was really evident during this COVID-19 crisis that the health workers, including midwives, are really backbone of a functioning health system. And WHO reports say that by now more than 125,000 health workers have been or are infected with COVID-19. So this leads to even greater restrictions in access to healthcare, and midwives and other health protections also play a key role in providing basic health services in humanitarian and in fragile contexts. So it is so important that we provide special support and protection for this group of dedicated people to enable them to do their extremely important work. And this begins with very, very simple things of protection material. But please allow me to make one more remark in principle. I think it's important, and Germany continues to be committed to implementing the Global Action Plan. And so I would like to underline once more that as donors and as actors in this wide field of primary health care, including midwifery services, we have to assume responsibility and further improve of our mutual coordination. So we should work together. We should even better work together, cooperate, create further synergies so that really women and adolescents have access to what they should come first in all crises, the right to protection. And this, of course, includes the right to basic health services, especially when they are pregnant, especially in vulnerable situations for young girls. Thank you very much.
Thank you very much. And so we are on top of the hour, and this is the session where we can take questions from the audience. I don't see one yet, so I would like to pose a question myself. We have seen that the State of the Midwifery report, State of the World's Midwifery report is highlighted. We have a gap of 900,000 midwives. Annika mentioned that particularly in Africa, we have not seen a lot of change. And at the same time, we know that looking at population projections that more than 50% of the births by 2050 are going to be in Africa. And how are we going to have that effort to really support midwifery and midwifery services on the African continent to be able to anticipate this increase in number of births and make sure that every child and every mother, every woman in Africa has the same quality of care, has the same beginning of life, the same start of life, etc. Any reflections from any of the panel members? Annika, please.
So maybe to kick off, and I hope others will join. I do think that we need to make sure that we go from funding to financing, that we find ways where we can really support governments to invest their domestic health budget into strengthening midwifery. And the way we can do that is really when we have data, when we have the evidence, when we have studies like the one that preceded the State of the World's Midwifery, where we can in hard terms say that if you invest in midwives, this is what the development will be. I think that we really need to work on a broad front to strengthen the whole health system, to be able to have, midwives in there. So the investment is needed financially, but also in all the other areas that we've been talking about. And I think that when countries get to own, as you mentioned yourself, Anshu, that taking each report for each country and looking at that, making a roadmap, making a plan, and that's how we can support countries to embark on what is the most suitable strengthening midwifery pathway that they can take. Thank you.
Thank you, Annika. And I see that Minister Peggy Fidelt has also would like to come in. Over to you.
Thank you very much. In terms of how do we improve the midwifery services and care to women and children in Africa, I think as a continent, we face a lot of challenges. And I think Annika has made reference to the lack of sufficient data to assist Africa in countries in Africa to come up with really reliable information on the number, the type of skills, the kind of skill sets that's required, and also not only in terms of numbers, but where and who, and where do we place where are the inadequacies of different skill sets. So assisting countries in Africa to develop reliable data collection and using those skill sets, coming up with a national health workforce account will go a long way towards addressing that problem, because we need to know how many we need, as well as how do we get them trained, how do we deploy them, because that's another major problem. The actual training, we do not have sufficient institutions, nor do we have enough educators, nor do we have enough programs, as well as not enough recruits in many instances in profession, so that we can have equitably distribution of health of midwives. As well as we need to strengthen and build health systems, because for the midwife working out there in the rural village, district, and not having the required resources, not having the supervision that's required, having to take on all the abuses and all the disrespect then that's not motivating for any groups of people to come into profession. So all these are things that needs to be really, really well addressed. And as we move forward, I think the first thing is assisting countries to get the required information, and then building on innovative ways of training the numbers that's required, and us getting not only train them, but also help them to get employment once they train, because that's important. Thank you.
Thank you, Minister. And that's a very important point, because often we do train people, but then they're not absorbed into the public health system. Maria, I think you also would like to come in.
Thank you very much. I couldn't agree more than that the Minister just mentioned. It is so important, the absorption, of course, but also closing the gender pay gap, giving women career opportunities in the health sector, and giving them the chance, and that was also mentioned before, giving them the chance to have a say in decision making in the health sector. I would like just to give you an example. Between 2016 and 2019, the GIZ, the German Development Organization, and the Health Ministry of Liberia, they together carried out the project Employment-Orientated Support of Women Working in the Health Sector, in order to give women better career opportunities in the health sector. And the project involved career advice services for girls at secondary schools, scholarships for female students, and targeted measures to build leadership capacities. I think this is a very consistent project which took all the different things together you need to improve the health sector and to encourage young girls and young women to go into this profession.
Thank you, Maria. And maybe also linking up to your previous comment on the SDG Global Action Plan, I think what is very important that as part of the universal health coverage roadmaps that are being developed at country level, the services for women and children should be included, and including the health workforce and the training of those specific cadres as well. Sally, I think you also would like to come in. And you're on mute, Sally.
Yeah, sorry about that. I muted myself. Just to add to this, because obviously it's multi-dimensional, and there's many different approaches that need to work together if change is going to happen. But perhaps one of the, or some of the areas that haven't been spoken about yet are the importance of, first of all, really raising the profile of midwives and helping women in communities to understand who midwives are and what it is that they can offer to them and why it matters. Because if women add their voices to midwives in advocacy to governments, and they are using their political power to bring attention to the need for more midwives, that will also help. But then we need standards, we need really good quality education services, and I think this is something that ICM is able to contribute, because we have set the definition of a midwife, the scope of practice of a midwife globally. We have global standards for midwifery education. We have already, but we are now developing more, and also with UNFPA, resources for countries to use to strengthen their midwifery education programs, and to strengthen their regulation programs. And we've also been bringing more understanding and attention to what the environment is that is needed by midwives to be able to work effectively. So I think all of these different aspects need to come together with, first of all, the real will of a government to decide to make this investment. And there's many ways in which we can help bring attention to that and help get that decision, I guess, that this is an investment that's worth making, and then all of the parts that we can do to help get it there. Thank you.
Thank you. And before I ask Annika to come back in, I'd just like to reflect on a few comments in the Q&A. One is around bilateral donors, do they have bilateral programs for, let's say, midwifery services? Is that seen as a topic within their bilateral development cooperation? And another comment is about the chief midwife, and would it show strong leadership if we have chief midwives employed in the different governments? What do the panel members think about that, about having a chief midwife in the Ministry of Health? Annika, over to you, and maybe you can also reflect on some of these comments, and others can also come in.
A very short addition to what I said earlier, what is important to get midwives on the ground, especially in Africa. I think I want to mention that countries like Germany, showing this very strong example of how important it is to you for your investment, is a very key, also part of the solution. Because as long as we say that this is an important thing to put money on, that raises the self-confidence in midwives, but it also raises government's trust in what is important. So I think that's really key. And on the chief midwife side, I think that should be for maybe Sally to respond to, but I strongly believe so. I think we need to also show that midwives can take those positions, and midwives need to be in charge of the care that they are going to deliver, to make those plans and to see where the gaps are. But let me not talk more. Let me hand it over to others. Thank you.
Thank you, Annika. And I think Sally would like to come in here.
Thank you, Anshu. Yes, indeed. I mean, I think that recognition of a chief midwife actually means a lot of things. It means that there's an understanding that midwifery is a separate and distinct profession in its own right. It isn't the same as nursing. And I think that's a really important thing to understand. So if you have a chief midwife, that chief midwife is speaking for the profession, and able to provide good advice about what the midwifery profession needs in order to be able to work effectively. But that midwife also needs to have support. She needs budget, she needs staff, she needs decision-making power. So the position in itself is important, but it needs to have all of those aspects underneath it. And then that chief midwife, alongside a chief nurse and a chief medical officer, is so often the case, is able to really speak out and help any particular government to develop the midwifery service and to help strengthen it. So it is a very important, one of many very important strategies.
Thank you so much, Sally. Maybe just another question, I think, and that's really coming to, how do we look at the pandemic as an opportunity to take this forward? We are now in our recovery phase. We know that this will require additional investments. Any thoughts on how our stimulation packages, recovery packages that governments will put up, can be also targeting the increase in the health workforce, and in this case also, as this is our interest for this session, in midwifery? Helen.
Yes, I think we've got to look at the counterfactual here, because those who've been on the front lines of providing health services during the pandemic have had a pretty stressful time. And if we don't invest, and if we don't, affirm the status, the contribution, look at the pay issues, we'll exacerbate further the workforce pressures that we face in areas like midwifery. So I think in the recovery, this really has to be attended to, that people have gone the extra mile to do what they can in very difficult conditions, but you can't keep giving and giving and giving if you feel that you're not supported and well remunerated for that. So I'd be giving that priority. I think Frank Accardi's proposal about the chief midwife is also a very interesting one. I was busy Googling to see what current arrangements there are in my own country, and I find that at the district health board level in the regions, there's often seems to be a chief midwife or a director of midwifery services, but it's not so easy to find at the ministry level. So, ensuring that there is that clear function and professional leadership for midwifery at the top echelon of health ministries, I think would be very, very important. Mm-hmm.
Thank you, Helen. And before we maybe go to the final closing remark round, maybe I could just ask the Minister of Health to come in on your last point, Helen, and to have a reflection from the Minister on whether she thinks it would be of benefit for the ministry to have a chief midwifery officer besides a chief nursing officer at equal level, let's say. Minister, do you have any reflections on that?
Definitely. I kind of held back and rather than come in immediately to hear what others say. But I fully believe that the input of a midwife at that position is very helpful, because unless we have that, we don't get that midwifery voice at the level that's required. As to whether it is, in my own country, the way we do this is because we're a small country, we're working on a small workforce. The position of the chief nurse means that the person also has to be a midwife, and the person needs to have had midwifery experience during a career so that she's kept up and able to speak authoritatively on the two professions. And it will depend on different countries, obviously, depending on their specificity. But without the voice of a midwife and at that level, I think we would be losing a lot of opportunities of advancing the profession or even maximizing the contribution that the profession can make to healthcare. So I'm a strong supporter of having a midwife, heading at the national policy level. Thank you.
Thank you for those reflections. And so we'll now come to our closing remarks, and I think we'll take them in reverse order from the opening remarks. So I think we'll start with Annika.
Thank you. And it's been really a very rich discussion, and I think we have much more to discuss. But what I take away really from this, and what I would like to say looking forward, is that we really need to make investments, and we really need to make sure that those investments benefit not only the women and the teenagers that are being sort of served, but also the midwives. And that has come through very strongly today. I think that we need to make sure that not only we, the like-minded around midwifery, understand what needs to happen, but we also need to take on those that are maybe a bit more tough. And we need to invest in professional collaboration efforts so that the team around the birthing woman, the teenager with an unintended or unsafe pregnancy or unsafe abortion, is being taken care of in the best way. And we need to make sure that the enabling environment for midwives provide them with the opportunity to actually provide respectful maternity care or respectful care at large. Thank you. And maybe to add, UNFPA will continue to be totally committed to this. Thank you.
Thank you, Annika. Then next would be Maria for some key take-home messages.
Yeah, thank you very much. So I would like to summarize the German priorities as follows. First of all, the access to maternal and child health and other services related to sexual and reproductive health care is fundamentally important to achieve the goals of the Agenda 2030. And the access must be achievable for all people everywhere. To achieve these goals, we must also continue to invest in maternal and child health care professionals and work towards delivering universal health care coverage for all people. And we will only success if we have strong, professional and highly qualified health workers. So we will use new health-related focus areas of the BMZ, of our ministry, which include pandemic prevention, the One Health approach, and sexual and reproductive health and rights to support sustainable investments in human resources in the health sector. In doing so, we need to also take account of the special needs that female health workers have. These includes ensuring adequate salaries to close the gender pay gap, giving women better career opportunities in the health sector, and giving them a say in decision-making in the health sector. And what I would really like to add at the end of our discussion, all these investments in health, in midwifery services, they pay off at itself. You know, the next pandemic, the next epidemic, which meets us again unprepared, it will cause so much damage and cost so much that is in any way cheaper just to invest now and to take that home at lessons learned. Thank you.
Thank you very much, Maria. Then next, I think we'll go to Sally.
Thanks, Anshu. I just want to take the opportunity to inform people about something else, and really just to say that, you know, midwives have always been at the forefront of individual and social change, and yet most people have a very narrow understanding of who midwives are, what they do, and most particularly how they do it. And despite the fact that midwifery is a practice of positive social change with the potential to help transform healthcare and community well-being, the profession has largely been left out of feminist advocacy agendas. But due to the gendered nature of a midwife's work and the realities of a health sector where women care for women, governments have largely ignored the evidence supporting midwives and midwifery, and this has got to change if we're going to come remotely close to achieving the Sustainable Development Goals. And ICM and a number of our partners, including some here, have signed on to the PUSH campaign, which is a decade-long global movement for women and midwives who protect and uphold their rights and bodily autonomy. In line with our collective desire to see greater public and private sector investments in midwives and midwifery, PUSH will engage traditional and non-traditional donors and elevate and align midwifery in donor funding priorities. And most particularly, what we're working on is more funding for more midwives, improved education and training, better pay and working conditions, status, respect and autonomy, and improved gender norms. So the more voices and partnerships that we have backing this cause, these causes, the more likely we are to succeed in making the investments in midwives and midwife-led continuity of care that we've all talked about today and seen as important. Thank you, Anshu.
Thank you. And then I would like to go to the Minister of Health from Seychelles, Peggy Fidote. Your final reflections, please.
Thank you very much. I think as we look at moving forward and ensuring that the SDGs are met, we need to really have a concerted effort globally to invest in midwifery. And we know that the global shortage of midwives need to be addressed, and this can only be done if we looked at how many more, and we know how many more. I think the numbers that's floating around are maybe have come around purely based on the basis of data that's available. but imperative that countries really get to know what they need. And this, I feel, can be done if all countries, especially we've talked of Africa, where the numbers could be many, many more than what's being sort of highlighted. If we can assist countries to come up with national health workforce accounts, that will speak to the quality, to the numbers that they have. We also need to be more innovative in terms of how we maybe come up with those numbers, and look here at developing partnerships and collaboration to increase the numbers. I know for sure that we, for example, in my past life, I've worked with different universities across Africa, especially Eastern, Central, and Southern, as well as universities in UK, to build, to come up with a prototype curriculum that facilitated to train midwife educators in different countries. And this really helped to increase the number of trainers so that we could, and that was at a master's level, so setting the quality that was needed in improving midwifery education in that part of Africa. We need to have more equitable distribution of midwives within countries and address the gender disparity in pay. And we need to have midwives in policy-making decisions at positions at all levels, not just at the national level, but at district level, at regional level, at hospitals level, at primary healthcare level, because at all these levels, midwives need to be contributing to whatever policies. And as we look at building on what we've learned in the COVID pandemic, we need to really look at investing in building more resilient health systems so that continuity of care for women, children, newborn, youth, adolescents, and all that are not discontinued because of shocks which health systems, are subjected to. So in moving forward, I believe all these may help towards improving the health of sexual and reproductive health for women and children. Thank you.
Thank you very much, Minister. And Helen, final remarks from your side.
I think we should take the opportunity of the reviews which have to happen around how the pandemic was responded to put the issues we're talking about today on the table. That midwifery is an essential service. It's a women's profession which services the needs of women. It deserves to be recognised as a senior and serious health profession with autonomy, and it needs pay and conditions that do justice to that. If we can get the settings right, then midwives will feel that they can practice to their full capacity and that they can lead on respectful services and dignified care for women. And that's what every woman wants.
Thank you, Helen. Thank you very much for this interesting session, and particularly responding to a couple of these really critical issues on how to take this forward. I just wanted to highlight that WHO, UNICEF, UNFPA, and ICM have got a framework for action for midwifery education, really looking at how to move this forward. It's got 7 steps that also start with doing an assessment at country level about the number of midwives, but it's looking at, do we have the training cadres? Do they have the skills to actually train midwives up to international standards? And then looking also in how to support the training, etc. And also this is a very important agenda item for the World Health Assembly, where we have every couple of years an agenda item on the strategic directions for nurses and midwives. And leadership is one of the 4 components there. Education is another one. But I think we've spent a lot of time today talking about leadership. And we've heard from the minister that, for example, having a chief midwifery officer equal at the same level to a chief nursing officer at the Ministry of Health would be a good way to, for example, take that leadership function forward to ensure that we have equity and equality for midwives, that we can look into pay issues and strengthen this cadre in order to deliver the right kind of services. We know that midwives provide 50 or maybe more than 50 different kind of interventions that have an impact on the woman, the pregnant woman, the newborn, the child, and the adolescent. So it's a cadre that has a tremendous impact. It is essential to primary healthcare and to universal health coverage. And I think we should make sure also that this is mainstreamed into the universal health coverage roadmaps at country level. Having said that, I want to thank the panel members tremendously for their participation, and thank you all very much.